everyone, my name is Jesselyn and I'm a medical student at Erlangga University. And now I'm excited to share an overview of my research exchange at Nova Medical School in Lisbon, Portugal. So in July 2024, I joined a research program where I work on projects related to breast cancer and sport medicine. I was assigned to a project titled Effects of Resistance versus Aerobic Training on Ki-67 and Other Health-Related Biomarkers, the NEO program. This study was conducted at the Champalimot Foundation and led by Professor Maria Joao Cardoso as the head of the breast surgery department. So Champalimot has both research center and clinical hospital that only focus on cancer. Breast cancer patients there are monitored through exercise program. Some patients do the resistance training, which focus on muscle training, while others do the aerobic training to improve the cardiovascular fitness with walking or cycling. Using the in-body device, we measure muscle mass, body fat percentage, and total body water to design personalized exercise plans. In addition to the research, I had the opportunity to observe some breast cancer surgical procedure at the Champalimot Hospital. These include lumpectomy, breast reconstruction, central venous catheter removal, latissimus dorsi flap procedure, and skin grafting. This hands-on exposure significantly deepened my understanding of surgical techniques, especially of breast cancer. I also got the chance to join another sport medicine research led by Professor João Pedro Magalhães, which focused on body composition, and there were 3 studies of it. The first one explored how BI parameters like face angle, resistance, and reactance can reflect the body composition in youth. I assist in measuring BI parameter using a face-sensitive BI device and connected the X-ray scan to assess bone mineral content and fat mass. I also contribute to evaluating hydration status by analyzing salivary sample using a freezing point depression osmometer. The results showed that face angle correlated with most body composition component in youth except for fat-related components in male. The second one explored the relationship between PIA parameter and factors such as physical activity, nutritional status, sleep, and fitness. We used actigraph accelerometer worn on a non-dominant wrist for 7 days. I even had the opportunity to wear for 3 days to better understand of the process. I also analyzed the data to evaluate children's sleep quality and physical activity patterns, and then correlated the findings with the dietary questionnaire results. The third study focused on the effects of hydration change on neuromuscular function in athletes, and we assessed this using urine mass spectrometry and saliva chromatography. And the results were presented at CDOC Nova Research Center. Towards the end of my exchange, I visited Hospital Dallas Lisbon, one of the most advanced hospitals in Portugal. There I saw high-tech mannequin that mimic real physiological response and AI-powered emergency simulation used to train doctors in critical cases like cardiac arrest or trauma. I also observed robotic surgery simulator using the Da Vinci system, allowing surgeons to practice complex procedures with precision. Outside the lab, I had the chance to explore Portugal with other exchange students. We started with a walking tour of Baixa, the heart of Lisbon, and the streets were full of beautiful buildings, and we got to learn a bit about the city history. Then we took a trip to Sintra, and it looks like a fairy tale with its green hills and stunning palaces. We also visited like Castelo de São Jorge and Cristo Rei statue, where we enjoyed amazing views of Lisbon and learned about the city Moorish history. And in my opinion, Lisbon culture was so amazing. We watched open-air theater, explored museum, and took a day trip to Cascais, where we wandered through cozy streets and ate delicious seafood. And one of the best moments was the national food and drinks party. And because I finally got to try Portugal famous pastéis de nata and bacalhau. To experience the city like a true local, we hopped on the classic yellow tram. We even got to watch the Euro final together to support our football team. And later I joined a national social program in Porto for 3 days, and we even went canoeing, and it was a great way to end my time in Portugal with the other exchange students. Overall, this exchange was much more than just a research program. I had a chance to collaborate with international students and doctors, and also explore the Portugal approach to medical innovation. This skill, insight, and perspective that I gained have inspired me to contribute more to health research and